Welcome to the 4th ASEAN EU Cooperation and Scholarship Day. You are now in the reception area. Here is the list of events we have prepared for you. Click on the schedule button to get a reminder on your phone or devices. Just dropping in to see what's on? Find this little red button to see which event is currently live and just join the fun. Take the time to explore the expo area and see what have been prepared for you. Here on the booth panel, you can have a one-on-one Q&A session with our exhibitors. Download all the information that interests you, join workshops and sessions, or try out the games. Each session also has its own booth panel for you to interact with the speakers. To have a conversation with an expo representative, click Share Video and Audio. The booth moderator will allow you to have a conversation with them. Have something to say? Head on over to the Voice of Youth booth. Pick your virtual background and overlay and say it with a photo or video. Don't forget to follow and tag at EU in ASEAN when you post it on social media. You might be the lucky winner to get a special hamper from the EU. We're so excited to have you here and we wish you a good time.
Good afternoon and welcome to the 4th ASEAN EU Cooperation and Scholarship Day 2021. I am so happy to be here and I am not alone, obviously. I will be accompanied by 3 amazing speakers that will share their in-depth experience and knowledge about the public health, which is very important nowadays, and it is one thing that we all experiencing together. But before we started, I would like to say that welcome to our session. I hope everyone is well and have had a chance to look around the expo today. So a quick introduction about this session. As the world grapples through the global COVID-19 pandemic, the role of public health and pandemic response becomes more imminent than ever. Is there a place for us as youth in this whole scene? We all experience the impact of the pandemic, but can we also be part of the solution? So that's why we have Nadira Nuraini Afifa from Indonesia and Olivi Silalahi from Study in Sweden and Muhammad Abdi Haryono from Nufik Neso. Before we start, I'm going to read their short bio first, starting with Olivi Silalahi. So she is a medical doctor and public health master's graduate from correct me if I'm wrong, Umeå University, Sweden. I hope Umeå, okay. With more than 10 years experience working for the betterment of children's health in Indonesia. Her work focuses on improving immunization and malaria programs and working with the government to develop national and sub-national guidelines, implement global, regional, and national policy recommendations, and develop monitoring tools to ensure strong oversight of program implementation. How are you, Olivi?
I'm well, thank you. Nice to meet you all here.
Nice to meet you too. And now I will introduce Muhammad Abdi Haryono or Igor, but I will call you. So which one do you prefer, Igor or Abdi?
Just call me Abdi.
Abdi, okay.
Yeah.
Muhammad Abdi Haryono, he is a master of he graduated from master's degree of epidemiology from Utrecht University in the Netherlands. Currently working as a health officer for Community Epidemic and Pandemic Preparedness Program and International Federation for Red Cross and Red Crescent Societies Indonesia Timor-Leste. How are you, Mas Abdi?
I'm very good, thank you. Thanks for having me here.
Yes, we are so happy to have you here. And also, last but not least, we have Nadira Afifa. She is a medical doctor who is currently working in Mother and Child Hospital. Graduated as a Master of Public Health from Harvard University. She is also working as a public health practitioner, focusing her work on addressing child malnutrition. Hi, Nadira.
Hi, Teresa. Nice to meet you all.
Nice to meet you too. Okay, because we only have a short period of time, so we have to be very quick. So I'm going to ask you some questions and hopefully you can provide a very concise but clear answer to the questions. So first, I want to ask Olivi. So you are a scholarship awardees from Swedish Institute Scholarship for Global Professionals, and now you are a public health professional with 10 years of experience. Can you briefly describe the education pathways to become a public health professional?
Thank you for the question, Trista. So it's a very interesting topic, and that's my passion for almost 20 years of my life. I've been doing this. So, how to become a public health professional? First, you need to have a commitment and also interest in health related topics, of course, because we're talking about public health. So, as the educational background, it is recommended if you have health related topics as a graduate. But then, public health is a broad topic. So even though your background is statistical or even policy or even research, you can enter this field, and then you can also apply for the postgraduate degree with those backgrounds. So actually, from the educational background, it's a broad field, and anyone can enter. And especially in the study in Sweden, from my experience in Sweden, I have a lot of friends came from statistical and even environmentalists. So it's enriched my education as a student when I was in Sweden learning about public health. So my tips
Okay.
first, uh, pay interest in any health related issues in your area, and then put effort to enter the any education related to health, and then you can move forward.
Okay, thank you. But for you specifically, why did you choose Sweden?
Okay, because actually like I said, I've been in this field very long time, and I was with UNICEF before for 8 years working in Maluku, and now currently I'm in WHO Indonesia as
Mhm.
a immunization officer, and it is for me Sweden. Always came out in any discussion related to health outcome. Sweden and other Scandinavia countries are posting a very positive message in terms of health outcomes. And
Yeah.
also, when I learned from one of my seniors before that, they managed to translate evidence base into the policy. So this is something that's very interesting for me to move forward, not only from the research or any literatures, but also to move it into the policy context and also to the community protocols and else.
So you can really put what you've learned into action. That's
Correct.
amazing. Thank you so much, Olivia. Now, I want to ask Abdi. So you studied in the Netherlands and you studied epidemiology. That's not something that very common to study, at least in Indonesia, obviously. But so why? Why did you choose to become an epidemiologist?
Yeah, thank you, Trisha. It was actually quite simple when I decided to study that at the time. Um, I wanted to become an epidemiologist first, and found that studying in the Netherlands can help me with that. When I graduated as a public health bachelor, uh, I thought of what contribution that I should make with the privileges of all of the skill sets that I have been equipped at the time. Because I believe that education is still a privilege even today, right?
True.
And I wanted to make an impact to the society at the time. All of those young, raw dreams and idealism when we
Mhm.
just graduated from bachelor. And
Yeah.
at the time, I felt a deep interest in health surveillance system because especially in Indonesia and maybe other South Asian countries, it is still a big issue to make a robust surveillance system in place, especially for health and infectious diseases. But when I thought about it, I still feel a lacking of skill sets about data and also, like Mbak Olivi said, evidence-based decision making. And I decided that I wanted to pursue more education in that field. And although it's not really related between surveillance and epidemiology, but some of the skills that I think I will obtain in epidemiology subject will equip me with necessary skills to be implemented in developing health surveillance system in Indonesia. Now, that's why first I wanted to become an epidemiologist. Yeah,
That's
I think that.
interesting. Okay, so for a lot of people, okay, we're now in this COVID-19 situation where
Yeah.
there's big public health issues, but what does an epidemiologist do in this current situation? What is your contribution? So that's maybe what other people would want to know as well.
Yeah, actually, when I studied epidemiology, most of my work will be around data and modeling. I think I thought that when I study master in epidemiology, I thought that will be my roles. But when I come back to Indonesia, I see that putting those knowledge in providing the stakeholders evidence and data for them to make a decision making is much more. It's not much more important, but it is one way to approach you in using epidemiology skill set. So what I've been doing is that I collected data and I provide to the stakeholders, and also I give recommendation of which program that they should pursue, especially in my work now as a health officer for International Federation of Red Cross and Red Crescent Societies, because I am currently working as an officer for community preparedness for epidemic and pandemic program. So we are preparing this community to be able to independently facing current pandemic and potential pandemic in the future. Yeah.
Okay, thank you, Abdi. Now I want to talk with Nadira. So Nadira, I think I can relate to you more because I also graduated during this pandemic. So you earned your master's degree in public health just the COVID-19 pandemic started, which is a very ideal situation for all students across the world because you cannot go to in-person classes and there's a lot of limitations in doing your studies. So for you personally, what made you interested in public health, even though before the pandemic hits?
All right. Okay. So, as you may know, I'm also a medical doctor, right?
Mhm.
So, I actually really enjoy working in the hospital, like treating my patients. But after years of experience, I actually found out that sometimes what made people suffer was more than just the biological aspect of the disease, but also the social aspect that follows. Like maybe some patient may be diagnosed with HIV, but what made him suffer was more than just the HIV itself, but also like the social problems because of it, like getting stigmatized by the neighbor, or like maybe having no insurance to pay, or like living in poverty, and many problems that actually cannot be solved by a doctor only. So I think that's what intrigued me to learn more about policy making, because I think if I can be a policymaker, then like I can create a wise policy that can actually save 1,000 or even 1,000,000 people at a time. So it's not about an individual anymore, and the scope would be so much bigger than just being a doctor. So that's what I thought that day. And yeah, that's what led me to pursue public health, especially focusing on the health policy major.
Okay, that's interesting. But okay, now we get a clearer understanding about what public health is from Abdi, from Olivia, and from you, Nadira. But can you explain a little bit more about what does it mean by working in the public health sector? What do you really do? Because I know you're a doctor. If you're a doctor, I can understand you treat patient like one by one, in person. But public
Correct.
health, so what are you dealing? You're dealing with the public, so that's kind of crazy, isn't it?
Okay, yeah. So I think, yeah, so many people don't actually understand what is the role of public health professional actually. Like public health often being overlooked. And it's just because of this pandemic actually that public health has been put into the spotlight like never before.
Yeah.
And I think people needs to know, just like you, needs to know what is the difference between a healthcare provider and a public health professional. So as a healthcare provider, as a doctor, our job is to provide a one-on-one consultation. We're focusing on treating individual, and we're focusing on like curing sick people and make them healthy again, right?
Yeah.
But as a public health professional, our job is more on like preventing the illness from happening in the first place. And it's more about creating an effective program that can actually touch as many people as possible. So we're not talking about an individual, but we're talking about, like what I said before, a million people at a time.
Yeah.
And I think like what Mbak Olivi said, it is also public health also engages people from many disciplines. So it's not just people from the health related background. So together we engage people from many disciplines and trying to find the root causes of the complex health problems, and then like together trying to find the holistic solution to that. So I think that's the keyword about public health. Like it's about as many people as possible. It's focusing on the prevention, and it engages people from many disciplines. Yeah.
Okay. Now all of us realize that public health is a very important issue that we need to face. But uh, okay, now we're in this pandemic. Now people more realize, more understand about the public health. But even if there's no pandemic, what does public health do to us, to the society?
Okay. So I think the best way to put it is, if I relate this to this pandemic, I think people will be more understand. I think if we hear a lot about wearing a mask and then like washing your hands often and then do the physical distancing, it is
Mhm.
all part of the public health measures, and it is
Yeah.
created by public health professionals. And also, if we talk about like the constant advertisement to persuade people to get vaccinated, to get a PCR test, it is also part of the public health communication, and it's
Yeah.
also part of the public health. And if like what Mas Abdi said about, like, if you hear a lot about the tools that can track the spread of the disease and then like predict the number of the cases in the future, the curve that we see a lot in the Google,
Mhm.
if you want to know the number of the cases these days,
Yeah.
it is also part of the epidemiology tools, which is also part of the public health.
Public health.
So if we talk about public health role during this pandemic, or even not during this pandemic, it is actually very crucial, and the scope of work is very broad and huge. So that's what I can think of about public health, I think.
Yeah, especially when because public health dealing with human, as long as human exists in this planet, we all need public health practitioners to remind them, to get vaccinated, not just for vaccine for the COVID, but for polio, for other stuff when we were for children as well, like immunization, like what Olivier focuses on. So
Correct.
let's move on. This year, the EU has just announced a 20 million euro support to WHO program to strengthen the region's health sector to respond to this pandemic and pandemic preparedness. So, Abdi, do you see an increase in interest in public health sector, you think, with
Yeah,
this amount of support of funding?
yeah, absolutely. I have been observing that, and it is true that there has been an increased interest in the public health sector. For example, first in international world, more and more donor approach shifting their budgeting for towards public health improvement, not only in treatments for or healthcare, but also in strengthening the healthcare system, engaging the community, for example, and for we can see also in Indonesia, for example, the government's programs related to public health have been shifting their interest. It's more slower than we would expect ideally, but we see that shift from, for example, economic interest to public health interest, for example. I also see the shifting in academic, where more and more cross-discipline discussions become more pronounced in the academic world. It is no longer a solitary discipline, like Nadira said. It's actually opening much more discussion with a lot of other discipline like
Yeah.
economics, health economics, a psychosocial approach to health, for example. And I see that become more and more pronounced these days, and media also become much more interested nowadays with this pandemic. They educate their writers about it, and also they hire experts in public health to educate the community to become more aware about, for example, how to prevent the disease
Mhm.
and how to get vaccinated, things like that. And last but not least, also the community. We see the slowly shifting from previously reluctant, and then they realize this is important for them, um, not only to get treated, but also to prevent, like now the case is COVID-19. I see they become more aware of that, even though they're still reluctant, some of our community. But I think we have just to keep delivering the message. All of public health professionals and also the community, we still have we need to do that to deliver to the community. I think that's my answer.
Okay, thank you. And for the rest of us who are not doctors, who are not epidemiologists, who are not public health professionals, what can we do to tackle this issue or to be part of the solution? Do you think, Olivier?
Yeah, another interesting questions. Yeah, this is the biggest topic in the whole world, not only in our discussion now, but
True.
in the whole world. Yeah. So we have the we know and we have the immunity
Mm-hmm.
to level down and control this pandemic. We have the evidence, and it is very clear. The first thing is to apply the health protocol. Prevention is the main key. So first, if you don't have to, or if it's an essential activities, please avoid large crowded places, close or not well ventilated area.
Mm-hmm.
Please choose to go to open air area. That's the first thing. But if you have to, then please put your mask appropriately, right?
Okay.
And do the hand hygiene. And also, the most important things is please be vaccinated if it's already your turn. Because now in Indonesia, government already rolled out the COVID-19 vaccination for above 18 years. I hope you can have the access. If you don't have it, please look in any social media presented by the government. Then you can register and then take your vaccination. That's the first thing that we can do as an individual. The second, because I believe everyone in this room is smart and very tech savvy, please promote the prevention
Okay.
in our own language, in the way, the style of the youth,
Mm-hmm.
right? So now it's a lot of issues, a lot of rumors, a lot of misunderstanding on how to control this pandemic. But please search for the valid sources. We have it allowed. You can search in the Ministry of Health or
Yeah.
in covid19.go.id or in WHO Indonesia. You can search it everywhere and you will find it, and please share it. So that's the two main thing as a youth that we can promote. And I believe one person influence the other, and then we can change the condition and we can make the condition in Indonesia better than what we have now.
Okay. But maybe quick question. What do you think and how do you feel as a public health practitioner about the hoax that vaccine is, it's not bad, it's a way to control human beings by the I don't know who. So how do you feel as a practitioner that you've been trying hard to make sure that people to do the right thing to protect themselves? It's not about protecting you as a practitioner, right? It's protecting them as well. So how do you feel? Just how do you think and what comes to your mind when you keep hearing this hoax that, oh, don't get the vaccine, it will make you dumb or anything, or you cannot get there's a lot of news out there. So what do you think and what do you suggest to people to encounter that kind of thinking?
Yes, I think as a public health professional, we're humans too. So sometimes we are disappointed, sometimes we feel tired, but this is a pandemic, right? We need more people to have a um, to have a stronger voices, and usually the younger generation have it, right?
Mm-hmm.
Usually younger generation youth have this immunity. So um, if I face or I read those kind of message, the first thing that I do, I need to verify. I need to stop, pause, and verify the information.
Okay.
From where the verification, the validation is from any reliable sources,
Mm-hmm.
right? And then after I confirm that it's a hoax, it's a rumors, then I
Mm-hmm.
just directly delete it. If you have time to give the link of the correct information, please do that. But the first thing you need to do, you need to protect ourselves. We need
Yeah.
to protect ourselves, and also we need to protect our family, and then extended family, and then ourselves, and then we can go bigger and wider. But first thing, protect yourself, protect the loved ones.
Okay, thank you. Itu dia. And itu dia. That's it. We need to protect ourselves and protect ourselves. And I would like to talk to Nadira again. So you just graduated from a public health degree. Do you have any tips for those who are interested in studying public health? Because you are obviously graduated in this situation that we need more public health practitioner, I guess.
Okay, so I think what people need to know is that if you want to pursue public health, you don't necessarily need to come from the health related background. So if you come from the law or like politics or communication or even economy, you can actually go applying to public health because it's pretty general and you can, like everyone can learn public health actually. And the second one, people also need to know that there are so many specific majors in public health. There are epidemiology and then like biostatistics or health economy, health policy, and many, many specific majors that you want to focus on. So if you have any specific field that you want to pursue the career in, you can actually research them first before applying to public health and make sure that you find the best school that you want to apply the public health to.
But what is the key attributes that you think would make a good public health practitioner?
I think as a public health professional, the crucial thing is to always be updated of the current news and also to always be aware of what's going around you. Because as a public health professional, you also have to respond quickly to the problems that are happening around you. And it's not always health related problems, but I think actually every problems will impact the health of the people. So just be aware of all the news that's going around you and like just equip your knowledge more and more about anything, just not the health related background, actually with all of the news that you can read every day. So I think that's the crucial thing about being the public health professional.
Okay, thank you. Sadly, we are running out of time, so I would like to invite all the speaker, and I would just ask one more question, just quick and short question. What is your professional message, like your from your expertise to the audience and or your message to the public about the current pandemic and how we can do to become part of the solution? Maybe we can start from Abdi. Sorry, you are muted.
Sorry. Yeah,
Yeah.
that's really interesting question. I would like to echo what Nadira said that we and Mbak Olivia also stated before that we need to be involved. Please spread the message over and over. Even a lie being told every times, it will become the truth. Let alone messages about important stuff like public health, like prevention for COVID-19. We'll have to always say that to the community, and then they will become more aware of that. My second point is actually more of a question to all of the people, all of the audiences here, and all of colleagues here. Are we ready for the next pandemic, for example? We are facing COVID now, but there is always a risk of the next pandemic. There is no guarantee that the next pandemic will come after this COVID or within this COVID period. So we have to ask ourselves about that, and we need to prepare for that. And we need to see in which point that we can contribute on. I think that's my thought on that.
Okay, thank you, Abdi. And Mbak Olivi, maybe Any last message?
No, thank you for the opportunity. It's been a lovely 30 minutes discussion, and hopefully the take-home message is be safe, be alert, and let's spread how to prevent this pandemic to prolong in Indonesia. Thank you.
Thank you, Olivia. And Nadira, is there any last message that you want to deliver?
I think I'm sure people have heard a lot about the herd immunity, that it is a part of the solution, that we need to reach at least 70% of the people vaccinated in order to end this pandemic. As per right now, it's only about 12 or 30% of the Indonesian has been full dose vaccinated, so it's still a long way to go. So I guess I hope people don't be too picky about the vaccines. The best vaccine available is the one. The best vaccine is the one that is available now. So get vaccinated and be the part of the solution.
Thank you so much, Nadira, Abdi, and Olivier, for your time in this session. It has been a very quick talk, quick chat, but it's very fruitful and very informative as well. So I would like to thank you all for being here. Thank you so much. And also thank you for all the audience who are attending this session. I am so delighted to be here. And if you want to know more about EU support for the WHO program, you can download a fact sheet from the EU delegation to ASEAN booth. Or you can visit Nufikneso and Study in Sweden booths in the Expo section to get more information on the scholarship programs. You can read their brochures or even have a live Q&A at the booth. We also invite you to visit the Voice of Youth booth to take your picture or record a video there. Tag at EU in ASEAN on your social media channels and share your thoughts on today's session. The best photos and comments will be shared on at EU in Asian channels and receive a surprise hamper from us. So my name is Tisa Triandesa. It has been a delightful 30 minutes from me moderating this session. Thank you so much and enjoy the expo. Bye-bye.